Mental professionals of Reddit, what is the worst mental condition that you know of? Honestly, mania. People's lives get ruined because of one manic episode. Thousands of dollars spent, random flights booked, and ending up on the other side of the planet with no way of getting back. I had a manic episode which developed into a psychosis that led to me being sectioned. It destroyed my life. I lost my house, girlfriend, dog, and friends. You feel on top of the world, having no idea how people around you may be feeling. Coming out of that episode was horrible, as I had no idea the ripple effect it had caused. Horrible stuff. The worst part is that while in a manic episode, you feel like you finally unlocked some secret to happiness. Like, all of your depression is gone and you're so motivated and interested in so many things. It all comes crashing down once you're out of a manic state and you see the wreckage behind you that you can't fix. Friendships damaged, opportunities lost, etc., and you can barely remember doing any of it. Huntington's disease. I'm a master's student and my research work is around HD. It has the symptoms of Alzheimer's, schizophrenia, and Parkinson's combined. Though it doesn't quite fall under mental health, as there's really not much that can be done aside from supportive/environmental care. You gotta let the family know that everyone's gonna get it, since, although it affects 1 in 10,000, it is a genetic disorder where even if one of your parents has the mutated gene, you definitely have a 100% chance of getting it. People have gone to extreme lengths of sterilizing their reproductive system in order to stop passing down the gene. It is a progressive disease, and it only gets worse with time. Starts from muscle twitching, to involuntary movements, inability to speak, and full muscle paralysis. The symptoms get worse with time. In fact, it gets so much worse at the end that the only relief is death to oneself. Life expectancy is max 30 years after diagnosis. Huntington's disease also is cruel, where it doesn't start showing symptoms until you're in your 30s, 50s. Basically when you most likely already have children of your own. So you unwillingly pass the curse on to your kids. It's just so cruel. Second-year med student. Had some of the scariest ones of my education a few exams ago, but frontotemporal dementia stuck to me. Your frontal and temporal lobe degenerate, causing you to be functionally drunk at all times, slowly getting worse over a year or two before you succumb. In those 2 short years, you will destroy all relationships while you lose your mind. Your family, your kids, your soulmate. You will treat them so horribly that they won't be able to put up with what you have become. And while your judgment deteriorates, and you commit more and more unforgivable acts against those closest to you, the frontal lobe degeneration will prevent you from understanding why they stop coming around. The chances of you dying alone are higher than the other way around. Frontotemporal dementia isn't satisfied killing its victims, it needs to kill their legacy. It needs to tarnish your memory in the eyes of those closest to you. Frontotemporal dementia is as close to evil as I have encountered in my education to date. There is no cure. Though not a medical professional, during my brief time working at an outpatient facility, I encountered a patient with body integrity identity disorder, BIID. Convinced that his arm wasn't his own, he consistently described it as feeling like a stranger's limb. His intense desire to have his arm removed led him into a deep depressive episode, culminating in a self-mutilation attempt that ultimately needed amputation. Post-surgery, he claimed to finally feel sense of peace. However, I left the job, so I don't know the lasting impact on his mental state from the surgery. BIID is still a relatively unknown identity disorder and doesn't have many treatment options so far. SSRIs are usually given to alleviate depressive symptoms, but it doesn't always seem to help. Going through something like that just seems like an awful experience. Dealing with those obsessive thoughts nonstop? That's gotta mess with your head big time. Catarrh delusion. I'm a nurse and had to take care of a huge man with this condition. He came in with some odd behavior and escalated to catarrh. The delusion makes you think you are actually dead. He would scream he was dead all day and night. Lived in constant terror. He was such a sweetheart, but became so worn down and terrified over time he got quite dangerous and punched a nurse in the face. Does this go away? I remember I was in a car accident long ago and, technically did die, was brought back. While in the hospital everything felt off, like just an inkling of doesn't feel right, where it was bizarre how normal and not normal it was, that I thought I was dead. It was nothing as severe as what the commenter above you posted though. I was also on heavy drugs that entire time too for pain management. For some people it'll be a temporary part of a temporary psychotic episode. For others with more consistent psychotic disorders it can be a long-term belief. Prosopagnosia. I had a patient with this as a therapist. They reported to the ER because their face fell off. The only thing therapy could accomplish was to teach patient how to use other markers to identify people. Capgras syndrome. The idea that the people around you are replaced with imposters. This one is absolutely hell on everyone. And in neuropsychic, definitely primary progressive aphasia. Basically, you aggressively lose the ability to speak and understand language. I had a patient once that was late to their appointment, and when they finally got there they were pissed because none of the signs were in English. They failed all of their language tests but passed all the other markers to rule out dementia. This person was an avid runner, vegan, perfectly healthy, and would likely go on to never be able to speak or understand anyone speaking to them within 5 years or so, yet live a long life due to no other health concerns. Edit. Since I'm being downvoted, I will say my prosopagnosia patient had sudden onset severe case. They were fine and then happened to walk past a mirror at work and they couldn't recognize any facial features that they could identify themselves by or any of their colleagues. They were brought to the ER in a panic state and their chief complaint was just that their face fell off, their exact words. The panicked feeling and the severity of this case was what made it a top 3 for me. This particular patient had a small stroke to cause this disorder and subsequently spent 3 years in a treatment facility recovering as best they could. It was an honor and a privilege to be a part of their care team. My grandmother developed early onset Alzheimer's and she had Capgras really bad in the early days. She would call me crying her heart out because her husband brought a stranger home from church and now the stranger won't leave and I can't find your grandpa. The stranger was my grandpa. It was awful for everyone. She cried all the time, missing someone who was right there. For any mental professional, if he or she would ever come across it, it's got to be fatal familial insomnia. There's nothing they could do but watch the patient waste away, if said patient end their life first. It's exceedingly rare, thankfully, only 40 or so cases as of 2022. I interned at a facility with a fatal familial insomnia patient. They were in therapy solely to help them cope with their impending fatality and working with the patient once they began hallucinating. It was horrible to watch how quickly they deteriorated. They died 8 months after showing symptoms. Clinical depression. Sitting in a room with someone and you can feel the void around them. It's like a complete emptiness. I worked with someone who accidentally set their bed on fire while smoking and was just watching it, like they were watching daytime TV. Zero emotion and zero reaction to move from it. It's chilling. Depression fucking sucks. And not in the fun way. There are days when I have to force myself to eat something, because otherwise I'd starve. There are weeks where I don't shower, because the cost seems too high. There were days when I had to actively keep myself from walking into oncoming traffic. I'm medicated and in therapy, but some days are harder than others. Delusional parasitosis comes to mind with this prompt. I've watched a patient go to well over a dozen doctors trying to get confirmation that they're parasite-ridden. After countless stool samples, blood work, labs, scans, biopsies, etc., she clearly didn't have any but remains convinced. A friend of my mom's ended up with something like this after getting into the wrong kinds of drugs. She was convinced that there were little bugs in her face. Absolutely convinced. She'd pick at her face day and night. Picked her face skin off bit by bit until the sight was horrific. She got clean for a little while, came to her senses, and stopped picking. But the damage was done, her entire face was scarred. I don't have it, but my psychiatrist referred to anorexia nervosa as the 7-year disease because in 7 years from diagnosis you're either in recovery or dead. Edit. If you're reading this, I'm really happy you're still here and I'm proud of you for fighting. It's really tough. No, I can't just eat something. Nothing matters to you anymore because all you think about is calories or how food seems tempting but so disgusting at the same time. It's been 2.5 years since I was hospitalized and I can still tell you the exact amount of calories in almost anything without even looking at it. Spending your whole grocery trip flipping over boxes and cans just to set them back down with a sigh, because you could never allow yourself to eat that. Your body will also never be the same. I have done a lot of healing, but I can never eat like a normal person again, even if I want to. Anything you eat making you sick, vomiting, bloating, diarrhea or constipation. Your hair will thin, or even fall out. You will always be freezing. Because of the bulimia subtype, my teeth are slightly eroded and my voice is different, especially my singing voice. It's not a pretty illness, and it's not a diet trend. I never understood how hellish it actually was until I was going through it. Not a professional, but in my opinion PTSD is one of the worst. My dad is a Desert Storm combat vet, and he is fucked. He went undiagnosed and untreated my entire childhood, and he was straight up abusive, physically, mentally, verbally, all of it. He became extremely suicidal in my later teen years, and became extremely violent to people in public, and we finally had to force him into therapy or an inpatient program. He's doing good now, no longer an abusive asshole, but damn did it ruin some lives. Maybe a basic answer, but as a therapist, severe OCD is the worst I've encountered in real life working in a clinical setting. It's completely indiscriminate of who it affects and has absolutely ruined the lives of some really brilliant and wonderful people that I've worked with. It's also more difficult to treat than you'd suspect. Medications and therapy are pretty effective for many of the more severe and chronic mental illnesses, but OCD can be particularly resistant to any intervention and causes such intense distress. Not at all trying to diminish the impact and difficulty of any other illness, but personally I think the more severe cases of OCD are terrifying. Scrupulosity OCD is pretty brutal. Basically, it's this fixation on going to hell, and the person is convinced they're going there no matter what. At its worst, it's all they can think about and talk about, distracting them from work and family. Knowing they'll burn in eternal torment one day slowly drives them mad. Reading through these, there are definitely scarier. But someone who is catatonic gives off a different level of concern. Basically, your mind moves so fast you become disabled and cannot move, sometimes for days. Think full-on human statues. When I was going for my associates, we had a really interesting psych professor. He used to conduct studies on catatonics. Sometimes if you sped up the video over a period of time, you could see that many were actually carrying out a task, like itching their face or adjusting their hair. Locked-in syndrome. From midbrain damage. Can't breathe on your own, can't move arms, legs or speak. Generally communicate from eye movement/blinking. Awake and cognizant the whole time. I was thinking about that as a neurological disorder. All my teachers would constantly say how hard it was. People who are otherwise 100% healthy, perfect cognition, are suddenly trapped inside an almost lifeless body. I recommend the movie The Diving Bell and the Butterfly, true story about it and just amazing. The guy managed to write an entire book, The Diving Bell itself, just by blinking, one letter at a time. I had a patient like that. At first I thought he was just in some sort of coma. But when you saw his eyes reacting and crying to certain situations, I just felt horrible. Most of the day he was asleep and would look at you with disinterest. But when his wife and best friend came to visit, it looked like he was in pain. The story that I was told was that once he got put into his current condition, his wife left him and started to bang his best friend. They moved in and everything. Don't know how true that is, but I was a nurse, I wasn't paid to be a detective. Mental health care trained, ended up in a different field. Manipulative personality traits. They aren't really diagnosable, they can be treatable, but paying for treatment is a nightmare cause it's hard to get a proper diagnosis. Manipulative personality disorder isn't a DSM-V disorder, but borderline personality is, but borderline doesn't cover actively manipulating family and children so that an adult can have an advantage. Manipulative personalities and behaviors create family environments which are hostile and abusive. But nothing can be done until the abuse happen. It's a gray area, which is why I think it's difficult. I work in psych intensive care. We had a guy with autophagia as a form of self-harm. He ate huge chunks of flesh off of his arms when he was hearing voices. That was pretty bad. Drugs are the worst though. Meth literally burns holes in your brain. I've seen brain scans from patients. Lots of people who are revived post-opiate overdose have hypoxic/anoxic brain injuries. It's like they've had a lobotomy. It's awful. Those drug-related brain injuries are permanent too. They'll never be able to live independently ever again. Not a medical professional, but for anyone interested in these cases, I strongly recommend a book called The Man Who Mistook His Wife for a Hat by Oliver Sacks. It describes different case studies including people with aphasia, face blindness, people who feel their body parts aren't their own. A man fell out of bed because he found a strange leg in his bed and threw it out. It was his own leg, hence he fell together with it. Some of the rarer dementias. There's one that literally turns a perfectly normal person into a psychopath. All their other faculties remain intact. There are dementias that literally melt your brain and don't even have a name. There are rare familial types of dementia so specific to certain families that they don't have a name but can develop really early, and again you know it's coming your way. And then there's Huntington's, which you likely know you're getting and have seen your loved ones go through it first. The embedded hallucinations in Lewy bodies can go either way, very distressing or comforting. With the non-organic illnesses, it's a toss-up between treatment-resistant psychosis and severe emotionally unstable personality disorder for the impact on quality of life. Not mental health care, but I work in hospice. The worst case of dementia I ever saw was a woman who had hidden her childhood trauma from her children, when got dementia and her only remaining memories were of abuse. She spent her days crying and trying to break herself out of her room, bloody fingers and all. It was horrific for her family, staff, her husband. Worst thing I've ever witnessed. I know it doesn't quite compare with schizophrenia and other things on this thread, but ADHD, especially untreated, is hell and will ruin your life if you let it. 80% of people with ADHD develop a mental disorder because of it. 20% of people with it attempt suicide at some point. Individuals with ADHD have a 6.5x increased risk of experiencing depression and a 3-fold increased risk of having dementia later in life. One of the worst aspects is that from an external point of view, it looks like laziness and unsociability, and so a lot of people think it is a made-up to prescribe pills to children. If they could live a few weeks in our shoes, I bet they would be more empathetic. Not a condition per se, and I bet there are more horrible things. But appearing/being perceived by others as more mentally handicapped than you actually are. Imagine being treated like a small child at all times, no matter what you say or do, your whole life, and all familial connections have long since stopped visiting. It's isolation even when around social people. All the time, forever. I had a patient who had regressed to an infant state, and in talking with them and working with them I got them toilet trained, doing their ADLs, participating in activities, expressing themselves, eating independently, and dancing. They got discharged back to their residence where they were treated like a severely handicapped person. Within 3 weeks they had regressed back to the infant state. 3 months gone in 3 weeks. Be kind to people, for no other reason. I'm a psych nurse in a psych hospital in Canada. Schizophrenia. Hands down, no contest. 90% disability rate, 30 years shaved off of natural life expectancy, astronomical suicide rate. Common comorbidities include both mental health and physical disorders. Some people still think schizophrenia is DID, which, obviously it is not multiple personalities, but a less ignorant yet even more common misconception is that schizophrenia is a monolithic disease, that is, it shares an underlying pathology between cases that causes it. The reality is that schizophrenia is nothing more than a cluster of symptoms, and there are many different pathologies that can lead to those same symptoms. Part of the reason schizophrenia has a reputation for being the be-all and end-all of insanity. You cannot go more crazy than schizophrenia. It does not exist. Schizophrenia is the end of the road for all madness. Edit. This blew up. Apparently it could use some clarification. The thing that makes schizophrenia so dangerous is not the disease itself necessarily, but because it almost never exists in a vacuum and isolated from other disorders. The extreme amount of comorbidities with schizophrenia, including practically every other mental illness and some physical illnesses, is what makes it such a killer, and the major contributor to shaving decades off of someone's lifespan. Many people with schizophrenia will self-medicate for their symptoms, and substance abuse definitely does not help. That's not even mentioning the meds. They suck ass, even if they work to control psychosis. The side effects are legendary for how awful they are. You pack on the pounds like it's nothing. Some of them can cause diabetes to manifest, and any number of other terrible side effects, ectasia, aka perpetual restlessness. It is the be-all and end-all of madness because it bleeds into everything. Edit 2. I was trying to not out myself here, but the number of tokens in the comments attempting to use their own experience to dismiss the struggle of all schizophrenics is really bothering me. I have schizophrenia. I have for 18 years. I've worked in mental health for only 3. Unlike these supremely lucky ones who spread trivializing bullshit from TikTok that it's not that bad, schizophrenia destroyed my life. It burned it all to ashes. I was subjected to dehumanizing, humiliating things that are common for schizophrenics to experience: police brutality, public humiliation and ridicule, etc. It took me over a decade to get back on track, to rebuild from nothing. I must admit, I did have a flowery view of schizophrenia, thought with the right approach, there's hope for anyone. If I did it, anybody could do, until I started working in mental hospitals. There are people there who genuinely have no hope of recovery, stability, or happiness. Their schizophrenia is degenerative, almost like Alzheimer's. Interventions are of limited effectiveness, if even at all. That's when I realized I'm one of the lucky ones. My patients tend to be a lot less fortunate. People like to pretend those people most severely affected by schizophrenia simply do not exist, out of sight, out of mind. However, they do exist, and their struggles are very real. The most real, even. Schizophrenia destroys lives, families, friendships. It is an insidious disorder that can adapt to resist treatment, something no other psychological condition does. It warps the very fabric of reality itself for those who suffer with it. Anybody who says it's not that bad is so full of shit that it's spewing out of their mouth. And, to everyone in the replies who attempted to use their own experience with schizophrenia to trivialize or dismiss this nightmare, you should all be absolutely ashamed of yourselves, every single last one of you. Honestly, it's disgusting. Come see the patients I do. That thought will never cross your mind again after you do.